Hello again, this is Dr. Joseph Shumelian. I hope you enjoyed the first video, and in the second video we'll expand your knowledge of keyhole mini implant dentistry for missing teeth. As you can see, the entry point for our implant is very minimal. There is no surgical intervention. It's a very small entry that allows us to place these implants through the gum into the bone, screwing that in gently so that it gives us a nice little stalk on which to place a porcelain crown. As I mentioned, it takes about 2 weeks for the laboratory to fabricate your porcelain tooth, and the good news is that it's very straightforward in one visit to replace a missing tooth and get rid of the acrylic denture or chrome denture, whichever one you may have, whether it be for a single tooth or for multiple teeth. You recall how a missing tooth can be replaced with an implant placed in the gum painlessly and a porcelain tooth placed over the implant about 2 weeks later to give you a very nice natural result, as you can see here. You'll recall also how we looked at a case where the front tooth was missing and replaced by a chrome denture, with something that many patients have and would love to get rid of. And the ideal method to get rid of it is to place a small diameter implant, a mini implant in the gum, in the bone, and connect a porcelain tooth within a short couple of weeks. We also looked at the replacement of a single missing side tooth, a very common issue where patients are missing a premolar or a bicuspid, and with the penetration of a small opening through the gum and the bone, an implant is positioned and a porcelain crown fitted to look just as though it's growing through the gum. We also looked at the case of a patient who had many missing teeth on the right side, and we were able to replace these with little implants placed in the gum painlessly, without bleeding, without stitching, without any form of surgical intervention, and the implants were positioned safely to carry these porcelain teeth fabricated by the laboratory and positioned, cemented on top of those around 2 weeks after the implants were placed. The upper teeth were attended to in the same manner, creating a lovely, complete result, both aesthetically and for chewing functionality. Now let's look at the next case of missing lower back teeth and getting rid of a large chrome partial denture. This patient had the misfortune of having had all the back teeth removed at an early stage. As you can see, there's nothing there. She also had the problem of these anesthetic metal clips around the front, which didn't look very nice at all. So here's the chrome denture which the patient was wearing, and as you can see, it's a large amount of foreign material in the mouth to replace those missing teeth. The missing molars were replaced with 5 mini implants, 5 keyhole implants, and a porcelain bridge fabricated on top of that to give this patient the ability to have new teeth, non-removable on both sides. A vast improvement on the situation she had been facing. In the third video in the series, you'll be able to listen to her story of how she really hated the idea of wearing the partial denture and how she was so thrilled to have a replacement that was no longer removable. Let's take a look at the replacement of missing upper teeth and getting rid of a very large acrylic partial denture. This patient was in fact the first one who came to visit me back in 2003 with an absolute need for a solution to this problem of having to wear a large plastic denture. Here's the denture in question. You can see it covers the roof of her mouth, has one clip only, so it means that the denture would be dropping on the right side constantly, rotating around that one little clasp. Without the denture, this was the unsightly appearance of her upper jaw. Being a social individual, this was not acceptable and really wanted a solution. You can see in the lower jaw, 2 little implants, 2 metal implants have been there for many, many years, and as a consequence of the fact that the lower bridge had lasted 25 years, she wanted the same thing on the upper jaw. We placed a total of 9 of the keyhole implants for her back in 2003 and created some foundations which allowed us to then place porcelain teeth on those supports. There she is, she looks marvelous, and the result of course eliminated the need to have any form of plastic coverage of the roof of the mouth. A very strong, stable foundation, a lovely outcome that has served her now for over a decade. Here we are with the x-ray with the implants in place, taken 8 years after the treatment was performed, and 9 years after the treatment. The bridge on the left side, where you can see the metal frameworks, the gold bits and pieces on the left, came apart, and you can see here the breakdown that had occurred, and once that section was repaired, this was the final outcome. A lovely set of porcelain teeth all the way around, nothing covering the roof of the mouth, and a wonderful way to enjoy her smile and the ability to chew and function normally. I'm sure you'll agree this was a lovely change for this wonderful lady. Thank you again for watching this video. I hope you gained some insight as to some of the ways in which we can help patients with missing teeth. If you have any questions, please email me at keyholeimplantdentist@gmail.com or contact my practice at 1300 966 663. And of course, you can always go to my website at keyholeimplantdentist.com to gain further information about this technique. Thank you again for watching, and we'll look forward to sharing another video with you very soon. Bye for now.